Hi class, I just wanted to go over a little bit about what you might see in a chart evaluation or even online. This basically is just showing you the location of their pain, what makes, what it is presently, what's their worst pain, their best pain that I was talk about. This is another good question. What's their acceptable level of pain? Because some people do have chronic pain and they are okay with a certain amount, or if you have post-op pain, and this helps them know, when they can take their pain meds. So I always use the guideline. I don't want my patient's pain to be more than a 5. I think halfway through is reasonable. So if it's higher than a 5, then we need to adjust the exercises or what we're doing with them, or give them some other tools or modalities to use to kind of help that pain stay below that 5 for them. Here is the quality that we talked about. So there's first is obviously the P, right, of our PQRST, and now here's our Q, the quality. Use their words. They may say prick. You can give them a couple examples and then have them kind of tell you what it is, and that'll kind of help you identify the tissue a little bit. Here you have the onset, duration, the variation. So how long ago did this happen? Did it happen yesterday? Did it happen 5 weeks ago, 5 years ago? All that kind of good stuff. Manner of expressing their pain. What relieves their pain, what makes it feel better. That's always kind of a nice thing, so you can kind of reiterate that for them as something that they can use to get it down to that tolerable level that they said. We already talked about what increases their pain, the effects of their pain. Does it bother their sleep, their appetite, their physical activity, their relationship with others, their emotions, their concentration, etc. So this is just kind of one pain assessment tool that you might see in the hospital done by nursing. And we have these other functional outcome measurements, which is short for FOM, and you guys know, like the Berg balance test that you probably learned in neuro and acute, and the TUG test. So we also have ones for pain and for function. And we tend to talk about pain as our 5th vital sign, right? And here we just kind of, again, talking about the onset, the pattern, the exact location, results of the pain questionnaires that you might fill out for them. Does it radiate, spread to other parts, their description, their social activities. We talked already about the pain at rest, pain at best, that kind of stuff. Do they feel their pain is getting better or worse since the onset of the symptoms? And that's always a really good question. And even when they come in for you, like, just to see, how are we doing? Is the therapy helping you out? And how long does it help you out for? So we know whether we're going in the right direction for them or not. These are just another couple different examples of different ways that you can have them fill out different functional outcome measurements. You can have them do that when they first come in, and maybe after a couple of weeks of treatment to see if you're noticing any changes. This is a checklist of nonverbal indicators that you might have. It talks about, whoops, sorry about that, getting happy with my clicker there. So then I have vocal complaints. There's that sigh, the gasp, the moans, that kind of stuff. And there's facial grimaces, and that's why sometimes when you're measuring somebody's range of motion, you're going to come from in front, or if you're palpating something, so you can kind of see what they're doing. A lot of times they will hold onto things, like you'll watch them come into the clinic and they'll kind of reach to the different things, or they'll reach to the wall, that kind of stuff, furniture, anything that's around them. Some people can't sit still, and that is another part of pain. They need to move constantly. They're rocking, or they're changing their positions a lot. Others will, come in and can see they're rubbing that upper trap, right, or that levator, their stress points. You're probably doing that right now while you're listening to these. Sorry about that. Maybe with a friend, so they can work on some of those trigger points. And then you just, the verbal, expressing their discomfort to you, telling you what's going on, and then you can score that. So that's just another option. We have these ones, and once we get you signed into WebPT, if you don't remember how to do it, the instructions are on our 264, so I'd really encourage you again to sign up on there, so you're, kind of got a heads up on where to go. But if you go into that one where you add a quick patient, then you would just kind of go to the next page and pick, like, let's say the cervical spine, and then it'll show these different functional outcome tests, and you can actually look at them and print them out. and practice asking them, because you will do this in the clinic. Usually the therapist will do this on the initial evaluation because it's required for insurance, and it also gives us an objective measurement to come back to. And then later on, it will usually be the assistant's job to retest these for them a couple months or a couple weeks down the way. So there's a couple different ones: the Neck Disability Index, abbreviated NDI. The lower extremity functional scale is very commonly used. It's called LEFS. Oswestry low back pain, I usually use the modified one because the studies have shown that it's equally reliable and valid. And same with the Berg balance test. I don't know if you guys went over the difference between that and the short version. Is also equally valid. So it just depends on the time that you have in your clinic and what your PT started with. You're going to want to duplicate whichever one they used. And so it's just encouraging you here to go onto a web PT and take a look at those. All right. There will be a few questions on the exam, just the basics of a SOAP note. What goes in the S? What goes in the O? What goes in the A? And what goes in the P? I think that's it. Thank you very much, and we'll see you later. Next videos will be on cryotherapy and thermotherapy, and then we'll be done for week 1.